Welcome to DMV Spotlight here in the nation's capital, where we shine a light on the issues impacting D.C., Maryland, and Virginia. I'm Barbara Britt, and today we are highlighting Alexandria and the Partnership for a Healthier Alexandria. I'm delighted to welcome as my guest the chairperson for the partnership, Allen Lomax. Thank you so much for joining me today on DMV Spotlight.
Well, thank you very much, Barbara. Happy to join you.
So I wanted to start by asking you, Alan, about, first of all, the Partnership for a Healthier Alexandria. What is the genesis of that? How did it come to be? I know it's a long-term plan, but give folks a little bit of a history on how it came together.
Sure. Well, back in 2005, the Alexandria Health Department facilitated the first community health needs assessment in the city of Alexandria. And out of that were several issues that needed to be addressed to improve the health and well-being in the city. And it was determined there needed to be a group, a community-led group, in order to help facilitate the implementation addressing those health issues. So the Partnership for Health Alexandria was formed right after that in 2006. And since then, it has been a coalition made up of businesses, city agencies, nonprofits, foundations, and community coalitions, members of Alexandria City's boards and commissions, and engaged residents. And the whole focus is to improve the health and well-being of everybody who lives, works, and plays in the city of Alexandria.
And then out of that partnership, and now you are the chair of the partnership, talk to us about the Community Health Improvement Plan. How do those two fit together?
Sure. Well, actually, the Community Health Improvement Plan is the roadmap for improving the health and well-being of everybody who lives, works, and plays in the city of Alexandria. And actually, the plan, community is really the highlight of it, because it was the community who came together to identify the priority areas in the Community Health Improvement Plan, as well as the strategies in order to address those priorities, as well as the tactics in order to advance those strategies in the plan. And all that happened starting in 2019 when when the Community Health Needs Assessment was released. And then starting right in that in October of 2019, the community came together and actually identified the three priority areas for this Community Health Improvement Plan.
And then share with us those three priority areas.
Sure. It's addressing housing, mental health, and poverty in the city of Alexandria. And the community felt that if we could address those over 5 years between then and 2025, then health would improve dramatically within the city.
You know, and it's interesting. I'm speaking today with Allen Lomax. He's the chairman of the Partnership for a Healthier Alexandria. So many communities, Allen, are facing those same three top priorities. In some ways, they're unique in Alexandria, but they're not unique to Alexandria.
Correct.
Yeah, it's just everyone you talk to is trying to tackle these things. So what are some of the strategies? I know there were some challenges dealing with all of that, and we'll get to that in a moment. What are some of the strategies that you have been working on in terms of dealing with housing and mental health and poverty in the city of Alexandria?
Well, actually, if you look at actually the plan has 21 strategies, and if you just think about some of these strategies, for instance, in housing, it's focusing on reducing eviction in the city of Alexandria of residents. It's addressing homelessness, reducing homelessness in the city of Alexandria. It's providing more affordable housing in the city of Alexandria, just in the housing area. In mental health, it's actually addressing such issues as trying to expand mental health services. It's raising awareness about mental health services that exist, and it's trying to reduce the stigma associated with mental health, so people will actually not feel that it's a negative aspect, and actually will go out and seek mental health services. And in the poverty area, we're addressing a whole host of issues that deal with improving education. Higher education is improving workforce skills. It's addressing key issues in the criminal justice system, employment resources, as well as reducing and eliminating the disparities in the internet, access to the internet, and even use of the internet once you actually have access. So that's in the three areas. Those are, so just some major areas.
And then obviously, as you were beginning to develop this community health improvement plan, focusing on these three areas, there were some very historic things that happened across the nation and in large measure around the world. What were those extra challenges that have perhaps either shaped or stymied or both your efforts?
Well, just as we had completed the initial round of identifying some strategies in March of 2020, just before that, there were the civil unrest that occurred due to African Americans, the highlighting of African Americans being unjustly affected by police officers. There was the pandemic that hit, and then there was the economic downturn that hit that really highlighted things that had existed in our communities, particularly our community, but the pandemic, the economic changes, as well as the need for better focus on racism and reducing the impact on the criminal justice system on blacks and African Americans were really spotlighted just during those time periods.
And then as we are coming out, we all hope, of the pandemic, that we now see also the huge impact that the pandemic had in terms of the mental health, particularly on our young people. Allen, talk to us about that and what may be done about that.
Well, there's our young people are being negatively affected by the pandemic, the isolation that went through, not seeing their friends directly, not being in schools to interact. But I will also say we are also seeing the same things with adults as well. By not being in the office, by not interacting with families, there was a lot of isolation that was being felt among adults as well. So what we're trying to do is we're doing this analysis to try to identify what services exist and what we need to do to expand services in the city of Alexandria. We actually, as a result of the Community Health Improvement Plan and seeking out partners to work in the plan, we created a relationship and a partnership with the George Mason University Center for Psychological Services. And they have an emotional support line. So we have been promoting that emotional support line in the city of Alexandria, so people can call up if they need help and talk to counselors about that. That's one of the new things that happened because of the pandemic and because of the Community Health Improvement Plan, and who we brought to the table to help us implement the Community Health Improvement Plan. Because actually the partnership is not implementing the plan. It's the community members and the Partnership Steering Committee, which is our governing group, is just facilitating the implementation of the Community Health Improvement Plan.
And then how much of this, Allen Lomax, chair of the Partnership for Healthier Alexandria, does it then go out to grants to existing organizations?
Well, actually, there's a couple of things. One, when there was American Rescue Plan dollars and the city of Alexandria was trying to determine how to allocate those funds, we participated in community meetings to talk about, if you do this, this is related, this is involved in it, this is a tactic or a strategy in the Community Health Improvement Plan. If you fund this area, this would help advance this strategy or this tactic. We did that multiple times. City Council heard that, and they helped fund other organizations because of that. Also, the partnership has its own donation fund. It's very small, but last year we released 2 grants to 2 community organizations which focus on advancing mental health. And this year, we haven't made the official announcement, but we have doubled it to 4 organizations who will be receiving grants for this year.
And then, so this obviously is long-term strategy, initially over 5 years. Has the COVID pandemic, the economic crisis, the racial and social unrest, has that sort of expanded now the timeline, or are you sticking to the 2025?
No, we're sticking to the 2025. And what we want to do is make sure we just keep plugging away and seeing how much we chip away. Actually, one of the things that we had in the plan related to poverty was to provide free bus service in the city of Alexandria to people. And because of the American Rescue Plan funding and everything else, the city is doing that. They've been doing that now. I think they're like in the first 18 months of that. So there's been a couple of things that have already been implemented, and we're still working. And of course, we have a lot more to implement. But there's been a couple of things that have already been implemented. So we have great hope for that. And again, the city tying this into the American Rescue Plan funding and to the Community Health Improvement Plan has helped City Council identify community needs better.
And then obviously those dollars are not going to keep renewing. And so going forward, do you have a way to measure the progress of both the Partnership for Healthier Alexandria and then underneath that, the Community Health Improvement Plan?
Well, we actually have measures inside of the Community Health Improvement Plan for each of the priority areas about what we view as would be progress by the end of 2025 and where we hope to get to. So right now, being the initial year and a half of the plan being implemented, we're really more focused on are these actions being taken place, who's involved with it, who's doing things, and so we're monitoring that right now.
And is that a difficult measurement to quantify because you really are talking about people's lives and how they are being impacted?
It's a little difficult to measure at times depending on which area you're at based upon what survey instruments exist. So sometimes yes and sometimes no, and sometimes we've have been able to get better data. I will say one of the things that happened on the pandemic was that eviction data was very fragmented in the city of Alexandria before the pandemic, and because of the pandemic, the city formed a work group to focus on eviction prevention, and they created a wonderful eviction dashboard that never existed before. So that's one of the new data points that hadn't existed even when we started the Community Health Improvement Plan that now exists that we can monitor and see how that area is going, for instance, underneath that strategy and those specific tactics underneath that strategy.
It's a little bit ironic because as we talk, it almost sounds like the pandemic and the influx of federal dollars really did help actually move this plan along. So just as we close out today, is there anything are you still looking for community input at this point?
We're not looking for community input at this point, but we're looking for community involvement because I said the implementation of the plan really rests upon businesses, organizations, foundations, and individuals to come together and say, yeah, I want to work on that strategy. I want to work on that tactic. Let me join that team that's focusing on that. So we strongly encourage any organization, any business, any company, and any individual in the city of Alexandria, please join us and work on implementing these strategies and tactics.
Well, I want to thank you so much for joining me today. I've been speaking with Allen Lomax. He is the chairperson for the Partnership for a Healthier Alexandria. Thank you so much for joining me on DMV Spotlight.
Oh, thank you. It's my pleasure. I love talking about the Community Health Improvement Plan. I love this plan, and I love what the community is doing to implement it.
Allen, thank you so much. I'm Barbara Britt, and join us again next week at this same time for DMV Spotlight.